Good morning, everybody. I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. So I'm asked practically every week if somebody who has what's called mitral valve prolapse needs antibiotics prior to going to the dentist. The reason for the question refers to the fact that the valve may be shaped or function improperly, increasing the likelihood of getting an infection on the valve, which is called infective endocarditis, which is a really bad thing. People die from it. The short answer is probably not, but I will dive into the topic and give you the facts. First, the picture on your left is the side view of a normal valve. As you can see, the leaflets, which is the top of the heart, closes, and it looks, like I just said, like the shape of a heart. Okay, now let me explain a little bit about mitral valve prolapse. Mitral valve prolapse means that one or both of the leaflets, because the leaflet is shaped like your lips, there's two leaflets, so one or both of the leaflets billows into the left atrium, which is the chamber above it, like the jib sail on a sailboat when the left ventricle pumps the blood out of the heart. So in other words, blood is supposed to go out, not backwards and up. And this is represented by the middle picture. It is still the shape of a heart, but you can see the billowing at the top. So it looks like this, a narrower heart. This does not mean, though, that the valve is leaking blood, contrary to what you may hear. When a valve leaks, this is called mitral regurgitation or mitral insufficiency and is represented by the picture on your right. And that can occur if the billowing valve two leaflets do not meet properly. So this means that the blood, which in a normal person, as I said, flows in one direction from the left atrium into the left ventricle and that gets pumped outwards, also goes backwards through the valve, back up into the left atrium and leaks. So mitral valve prolapse is a common disorder occurring in up to 8% of the population. And in the 1980s, everybody seemed like they would walk around and tell all their friends that they were diagnosed with mitral valve prolapse. So it was clearly overdiagnosed, and this was done just because family practice physicians in internal medicine would hear a murmur when they're listening to the heart. So voila, you have mitral valve prolapse. But that's not how it's diagnosed. The way it's diagnosed is by echocardiography, which is an ultrasound of the heart. And most people with mitral valve prolapse have zero symptoms. Now it's time to answer the question. Currently, antibiotic prophylaxis before a dental procedure against infective endocarditis is not recommended under practice guidelines for patients with mitral valve prolapse who are undergoing a dental procedure. Patients who are at high risk for an infection do require antibiotics and is only suggested in the setting associated with the highest risks of adverse outcomes if the infection occurs. Who is this group of people? Well, this are people who've had a previous valve, okay, made out of pig or a metal valve, people who've already had endocarditis, people who are born with a congenital heart defect, and heart transplant recipients who may develop valve disease. The risk of a valve infection is generally considered to be the highest for dental procedures that involve manipulation of the gingival tissue, which is the gums, in the periapical region of the teeth, or perforation of the lining of your mouth, such as when you have tooth extractions or drainage or a dental abscess. This includes routine dental cleaning. In contrast, the following procedures and events do not require prophylaxis ever, and that's just when you're injected and numbed up through non-infective tissue, taking x-rays, removing or adjusting your orthodontic appliances, placement of the orthodontic brackets, falling out of your teeth when you lose your teeth, or bleeding or trauma to the gums or to the mouth. Okay, so I hope you learned something today. For more questions, you can go to my website at www.paladinmds.com. And thank you so much, and have a great day.